Are you aware that some of the symptoms of diabetes show up at night? It's not a question that you may think about often, but recognizing the signs of this prevalent and severe health issue can have a huge impact. Let's delve into the understated yet important indicators of diabetes that frequently present themselves at night. These nighttime signs provide crucial information about possible underlying health issues. So, share with us in the comments if you're experiencing any of these symptoms. One of the early signs of diabetes is frequent urination. If you're waking up multiple times during the night to use the bathroom, it could be disrupting your sleep and indicating a potential issue with diabetes. This occurs because with diabetes, there is an excess of sugar or glucose in your bloodstream. Your kidneys have to work harder to filter and absorb this extra sugar. If your kidneys can't keep up, the excess glucose is expelled in your urine, pulling fluids from your tissues and causing you to urinate more frequently. This natural response is your body's way of trying to eliminate the extra sugar and should be taken as a warning sign for diabetes. Another important symptom to keep in mind is night sweats. If you often wake up in the middle of the night covered in sweat, it could be a sign of diabetes. Night sweats are usually caused by low blood sugar levels at night, also known as nocturnal hypoglycemia. This occurs when your body releases emergency hormones due to low sugar levels, leading to excessive sweating. Adjusting medication and diet can help manage night sweats in diabetics, but it's crucial to seek professional advice before making any changes. And before we move on to the next symptom, remember to hit like and subscribe. The third indicator are symptoms of hypoglycemia, such as sweating, trembling, increased hunger, confusion, blurred vision, and heart palpitations, which can present themselves during the night. This is mainly because the body requires energy even while resting. When glucose levels decrease, the body responds by showing these symptoms to indicate the need for more glucose. To manage these symptoms, it is important to monitor blood sugar levels regularly and consume balanced meals. Additionally, consulting healthcare professionals about medications is essential, as some drugs can impact blood sugar levels. Sometimes, having a nighttime snack with complex carbohydrates and protein is recommended to maintain stable blood sugar levels throughout the night. Our fourth indicator is restless leg syndrome, a neurological condition that is often overlooked but quite common. This disorder is characterized by an uncontrollable urge to move your legs, often accompanied by strange and uncomfortable sensations deep within the legs. These sensations, which are hard to describe, have been compared to aches, tickles, or even a creepy crawly feeling. You might be curious about the connection between this syndrome and diabetes. The link actually lies in the nerves. Prolonged high blood sugar levels, a hallmark of diabetes, can lead to nerve damage in your body over time. This condition, known as peripheral neuropathy, is a frequent complication of diabetes and can trigger restless leg syndrome. The damaged nerves send conflicting signals to the brain, resulting in the feeling of needing to constantly move the legs. Therefore, if you've been feeling discomfort or an overwhelming urge to move your legs, it's a good idea to have your blood sugar levels checked. Ranking at number 5 on our list is the sleep disorder called sleep apnea. This condition involves frequent pauses in breathing while sleeping, leading to interrupted sleep and feelings of fatigue the next day. The link between sleep apnea and diabetes is particularly significant. Studies have shown that individuals with diabetes, especially type 2 diabetes, are much more likely to experience sleep apnea. This connection is due to various factors, including the association of both conditions with obesity. Excess fat around the neck can block the airway, causing sleep apnea. Additionally, the metabolic changes from diabetes, like insulin resistance, can also contribute to the development of sleep apnea. Insulin resistance can disrupt the body's energy balance during sleep, resulting in breathing interruptions. The intricate relationship between these factors increases the risk of sleep apnea in individuals with diabetes. Let's talk about the next symptom, which is increased thirst, also known as polydipsia. If you're waking up frequently in the night with a dry mouth and feeling unusually parched, it could be a sign of diabetes. This happens because of high blood sugar levels, which make your kidneys work harder to filter and absorb the excess sugar. When they can't keep up, the excess sugar is excreted into your urine, taking fluids from your tissues. This leads to more frequent urination, which can leave you dehydrated, hence the increased thirst. Managing this symptom involves keeping your blood sugar levels in check. Regular monitoring, a balanced diet, regular physical activity, and medication, if prescribed by your doctor, should help. It's important to consult your healthcare provider for the best ways to manage your symptoms. Don't ignore increased thirst, especially if it's accompanied by other symptoms of diabetes, as it's your body signaling that something might be off. Moving to the 7th sign. If you're feeling exhausted all the time, even after getting enough sleep, it could be a sign of diabetes. Fatigue in diabetes happens when your body can't efficiently use glucose for energy. Without enough insulin or with insulin resistance, your body struggles to convert food into energy, leaving you feeling constantly tired. To combat this, it's important to keep your blood sugar levels stable through exercise, a healthy diet, and regular check-ins with your doctor. Getting enough rest and reducing stress are also key in managing diabetes-related fatigue. Did you know that having a dry mouth, known as xerostomia, could also be a sign of diabetes? Lack of saliva can lead to waking up with a parched mouth even when you're properly hydrated. High blood sugar levels can reduce saliva production, causing dry mouth. To manage this symptom, focus on good oral hygiene, keeping well hydrated, and using saliva substitutes if needed. Chewing sugar-free gum or sucking on sugar-free candies can also help. Remember, it's always best to consult a healthcare professional for proper diagnosis and treatment. And last but not least, sleep disturbances. It's important to mention that sleep disturbances can be linked to diabetes. If you're struggling with insomnia or experiencing restlessness at night, it could be due to diabetes. People with diabetes often face chronic sleep issues because their bodies struggle to regulate blood sugar levels, leading to nighttime hypoglycemia or hyperglycemia. Hypoglycemia can cause symptoms like sweating and shaking that wake you up, while hyperglycemia can result in frequent urination, causing multiple trips to the bathroom. Managing these sleep problems usually involves controlling blood sugar levels with medication, diet, and exercise. Cognitive behavioral therapy can also help with insomnia. If you're having trouble sleeping, it's crucial to consider diabetes as a possible cause and seek advice from a healthcare professional for proper diagnosis and treatment. In conclusion, diabetes symptoms that may manifest at night include frequent urination, night sweats, hypoglycemia symptoms, restless leg syndrome, sleep apnea, increased thirst, fatigue, dry mouth, and sleep disturbances. It's important to note that these symptoms are not a definite confirmation of diabetes, but they could signal the need for medical advice. If you are experiencing any of these signs, it's best to seek guidance from a healthcare professional. Diabetes is a widespread condition, and recognizing its symptoms, especially those that occur at night, can aid in early detection and management. So that's it for today, guys. Remember to hit the like and subscribe button if you found the video helpful. And as always, stay informed, stay healthy.